Hi everybody, welcome to Beauty Buzz with Lori. Today we are going to be performing a microneedling treatment for melasma protocol. So I'll be going over the protocol for that with you guys. Right now we're just going to cleanse the skin really well with chlorhexidine to make sure that it's nice and clean and ready for our treatment. And then I'm going to numb her. She'll numb for about 20 to 30 minutes. I like to try and let you numb for about 30 minutes just to make sure it's a more comfortable treatment. So we're going to go ahead and get started now. We're going to be doing her face and her neck today. Alright, so we've got her nice and clean, and I'm going to go over her skin with alcohol. And basically what this does is just make sure that I've gotten all the residue of the cleanser off, and then make sure that the clean is again nice. Make sure that the skin is again nice and clean. We're going to let this patient numb for 30 minutes and then we'll come back and wash it all off and get started with our treatment. Alright everybody, so we're back and she's been numbing for 30 minutes now, so I'm going to actually just remove the numbing and then we'll get started with her treatment. I like to let that sit on the skin for just a minute or so. This is the device right here. And so I've already put the sheath on it, which is protective for the device so that there's no DNA transfer. And then this is the cartridge. Every cartridge is only used one time. As a matter of fact, this device has a lockout mechanism once this comes off, and it cannot be reattached to be reused. So that's a nice feature. As you can see, the measurements on here, so we start at 0.25, which is this first notch right here, and we work all the way up to 2.5 millimeters. Alright, so we're about to start the treatment. So this patient has melasma, as I mentioned before, and so I'm actually treating her with TXA compound formula that is prescription that we prescribe here for you, and we're going to microneedle that into the skin. She also uses this twice a day at home on a daily basis. So we're going to go ahead and get started. When I'm doing microneedling, I have found that I like to work in sections because I'm doing several passes to hit each layer of the skin. So I'm just going to start with the right side of the face, all the way up into the temple. So we're starting at 0.25 millimeters, and I try to shade it in pretty closely together so I get a nice even application. When I'm numbing, I always go a little bit overlapping on the lips so that I can get right up to that to address any lip lines, whether they are existing or future. it, and I'm just going to switch directions. Now I've done the TXA into the skin. We only do one layer with that. Once it kind of dries up, then I switch over to my Neocutis Biogel, and I do mix a little bit of hyaluronic acid in that too, and I get great results with this. But that just allows for the pen to glide across the skin without pulling and tugging at the skin. And this has been approved to microneedle into the skin. We're up to 1 millimeter right now, so as you can see, the patient is starting to produce a little erythema. And she'll also have a little bit of swelling starting in before we're done. All this is normal. So I am now at 1.75 millimeters, so we are well into the dermis right now. This is where the collagen stimulation happens. As you can see, there's a nice even erythema there on the skin. There's a little bit of swelling starting to come in. Now I'm going to move to the right side of the neck. So melasma is not extended down to the neck, so I'm just going to use my gel over here that I've concocted to do the microneedling for that area. Alright, so I'm going to flip it all the way back to 0.25. We're going to do the same process in this section. On some patients, it's normal to see a little bit of pinpoint bleeding. This patient doesn't really have that so much. You can see like a little bit right here, maybe in certain areas. Some people have more than others. Everybody's different. But it's nothing to be alarmed about. We're already up to 1 millimeter. This is a pretty quick treatment, even if you're doing both the face and the neck. It's about 30, maybe 40 minutes. Remember, the whole point of this procedure is to stimulate new collagen production. Whenever we stimulate new collagen production, we're basically retexturizing the skin. It can help to minimize the size of your pores. As you all know, that's part of our aging process as well. Even if you didn't have large pores when you were younger, whenever you get older, gravity will help you out a little bit and make you have to come see me for microneedling. Okay, and we're back at that 1.75 millimeter, so this is the last layer. And again, you can see that nice even redness right through there. Everybody's a little different. As you can see, her redness has actually already started to come down in the first section that I took care of. However, tonight, don't you normally get red towards the end of the night? So she will get red again towards the end of the night. So some people, it kind of fades in and out a little bit. Some people walk out as red as a lobster and they stay that way for the first 24 hours. So everybody is just a little bit different in how their skin responds. Go ahead and turn to the right for me. as deep on the nose, so I like to kind of hit it whenever I do both sides of the face and then back on the middle again, just so we get lots of micro channels to help minimize the pores with that collagen production. So I'm back at 0.25 millimeters on the pen. So I usually start right here on the nose. Go ahead and get that out of the way. How deep I go on the forehead is a little different for each patient. It depends on if that patient has thick skin, thin skin, healthy skin. Those are considerations I make whenever I'm deciding how deep to go. For this patient, we're good to go anywhere between 1 to 1.25 millimeters. And remember that the skin on the forehead is not as thick as the rest of the face. Just 1 millimeter. Because of that bone plate on the forehead, the patient can feel this part a little bit more than like if I'm on the cheek of the neck. And if I'm going to stop at the 1 millimeter, I've got a nice even redness there. Alright. So we are done with this portion of the treatment, but I'm not going to turn my pen off because I'm going to demonstrate stamping technique. So stamping technique is basically from 2 millimeters to 2.5 millimeters. The needles are protruding out a lot farther, so you don't want to shade in the skin like we were doing before. It has to be a stamping technique or you run the risk of creating little lacerations all over the skin, and that's not our intent. We're trying to make those up and down the vertical microchannels to the skin in order to stimulate that collagen and push product down in there. So for Kim, she doesn't need a whole lot, so I'm just going to kind of pretend that she has some marionette lines or nasolabial fold wrinkles, but she really doesn't, but we're just going to do this anyway. You can do this as preventative or to actually minimize the appearance of the lines. So it's literally just an up and down movement for stamping. This does not feel good to the patient, so I always try to kind of talk them through it and make sure that they're doing okay. Always let the patient know they're in control, so if at any point they want me to stop, they don't want to go any further, they have that option. I also do this technique on necklines, which works really well. Tech neck is one of those hard things that we've talked about in the past to get rid of because we're always making those creases in our neck because we're always looking down at the computer or our phone. Okay, so that was just a lot of times too. Now on her, she's got healthy skin and it's not thick, but it's just the right thickness, I guess, and she's not really having a whole lot of pinpoint bleeding through here, just a tiny bit. Sometimes what will happen afterwards, let me turn this off. Sometimes what will happen afterwards is all of the redness on the areas treated will be gone except for the areas that I did stamping in. So that is a possibility. Sometimes that holds, hangs around a little bit, like a couple of days or not. Primarily with this patient, what do you say, about the 3rd, 4th day you start to experience some exfoliation. So her skin will start peeling a little bit. It's a flaking, it's not sheet peeling or anything like that, but we do want that skin cell turnover as well. Not everybody peels, but I'm finding that more people do than not. Are you feeling a little spicy? Mm-hmm. Okay. So spicy is normal. That's a nice way of putting that. We have a nice little sting going on the skin. So any leftover gel that I have, I'm going to actually put on the skin because remember we have created microchannels. This feels good to the patient. It helps to kind of cool them down a little bit, and it also doesn't waste product because we've got those open microchannels. We can put everything down right into the dermis. So, post-care instructions for microneedling. So this patient may not wash her face for 18 hours because it takes 18 hours for those microchannels to close up. These are studies done specifically by SkinPen. Crown Aesthetics is who produces SkinPen. And whenever they did a dye test after microneedling, they found that 18 hours is what it took for those microchannels to actually close up. So that's good information to have because we don't want to be pushing anything down in there that doesn't belong. Also, I recommend my patients don't put any makeup or sunblock on for a full 24 hours. And then we do like you to not exercise as far as get your blood pressure up and cause your body heat to rise for 48 hours. It's just an extra precaution, especially in like my melasma patients or patients that experience a lot of hyperpigmentation. We don't want to raise that body temperature in order to induce post-inflammatory hyperpigmentation. We've already stimulated and caused enough inflammation in order to get that collagen production going, so we don't want to take it over the top to where we're having adverse reactions. So this is what you can expect when you come in for a microneedling treatment. Thanks for watching.